you come to me and you want to look entirely different, erase every essence of who you are in your face, it's a no from me. There's nothing worse than us becoming salespeople in this industry.
What's your opinion about fillers, especially on the face?
There are so many myths around it. If you have filler, you can't have a facelift. You get puffy and unnatural. Who said that? If you go into a consultation and you have to decide on the spot if you're going to do something or not, you're not in the right place.
Interesting.
Do not have the treatment. It's not the more the better. I often have to spend time to undo a lot of the things you've done so I can start again. When you look at celebrities or influencers, they want to promote a specific thing for obvious reasons.
Yeah.
They don't tell you the 15 other things they've done before that thing. And you come to me wanting to have that one single treatment that somehow is going to make you 15 years younger.
Yeah.
There are clients of mine who spend thousands with me on injectables, but they would refuse to wear SPF on a daily basis.
Hello everyone, welcome back to WellSome. In today's episode, I have the pleasure to have with me Dr. Maya. Welcome to WellSome.
Thank you so much for having me. Pleasure to be here.
So a little introduction. Dr. Maya is a facial plastic surgeon and aesthetic doctor and medical director as well, which, wow, already. And the reason why I wanted to invite Dr. Maya is because we are all interested, I feel, in everything that comes with cosmetics and anti-aging and all the treatment that we can do actually to improve the quality of our skin and overall longevity. But there's also true that there's a lot of buzz, there are a lot of treatments, a lot of procedures. So I actually called the best one I could to clarify and just share the best information we can get from cosmetics and aesthetic in general. Dr. Maya, welcome to WellSome again.
Thank you so much.
So something that really caught my attention when we first had a call is that you're not only like an aesthetic doctor, you're so focused on enhancing already the beauty of your clients, and you're so focused on the confidence behind the treatments that you do. Can you please guide me through how you took this path and your overall experience, and what's your method when it comes to aesthetic and cosmetic?
Yes, absolutely. I think you're quite right. In anything I do in my life, I'm always about self-empowerment. So any decisions I make, I try to be intentional in my life for myself. Yeah. And I'd like to convey that to my clients, to my patients, whether it's through my surgical work or through my non-surgical work. I think people who find me and come to me have already done a little bit of research, and they are after a meaningful conversation. I think if you come to me and you want something fixed, that implies that there's a broken element there somewhere.
Yeah.
And oftentimes it's not your appearance. Oftentimes it's a feeling that you are after, and I need to figure out what that feeling is.
Yeah.
So I think the conversations I have, I would say with 99% of my clients, is a very deep, meaningful one. It's hardly about wrinkles and facial structure. It's often about what feeling we're trying to chase and achieve.
Yeah.
As we go through life, I've discovered that our external appearance doesn't always keep up with the wisdom and with the strength and with the experiences on the inside. And that bothers us sometimes. I mean, I'm also a consumer in the industry, and I do, treat myself as well with lots of different treatments available. But it's not because I'm chasing perfection. It's often because I want my outside to reflect how I'm feeling and who I'm becoming.
Absolutely.
So that's really what the consultations are about.
I really love this approach, and feels very safe, especially in a world where, for example, I was talking with my friends recently, and I went to a clinic and I felt extremely uncomfortable because I felt that the doctor was pushing me to do treatments that he couldn't even explain me what they were. So that's why I also wanted to invite you on the podcast, because I felt that you were beyond the typical, okay, you need this treatment and go for it. But you were scratching a little bit more under the surface. So, doctor, curiosity, and does it happen that maybe someone comes to you and wants to do something that is completely out of the line, and maybe you refuse to do it, or you recommend them to do something that is way more natural?
All the time.
Yes.
Yes, all the time. I find that my surgical training definitely prepped me for that, because as well as facial plastics, I also did oncology surgery, and it was life and death for most people. And I find that people's perspective changes when you have deeper conversations. So they come to you asking for something because they think there's a solution in there somewhere. And I would hate to do something inappropriate for the client when I know that they will leave feeling that solution is further away than when they walked in.
Yeah.
There's nothing quite like being disappointed in treatments that are not life or limb saving, but they're supposed to make you feel better about yourself. And it's very difficult when you go and see a doctor you've just met and you're trusting them to get you there.
Yeah.
So that's why those conversations are very important. I say no a lot, actually.
Really?
And compatibility with my patients and clients matters to me most. I work with incredible colleagues. I get second opinions. I refer people on when I feel like I don't agree with you on what it is that you'd like me to do, but I know someone else who could look at it from a different perspective.
Yeah.
If you come to me and you want to look entirely different to yourself, if you want me to erase every essence of who you are in your face, if you want me to treat a psychological issue with fillers and Botox, it's a no from me.
Yeah.
Because I know that there is a deep-rooted issue there that I am adding to. I am not helping you, I am hindering you.
Yeah.
And I am giving you a little band-aid for a core wound that's chronic.
Yeah.
And you actually need to be speaking, perhaps not to me, but to somebody else that you feel comfortable with.
Of course.
So yes, I say no quite often, actually.
Yeah, that's actually it says a lot about your ethic as well and your way of seeing cosmetic in general. Yeah. What is actually the biggest gap that you see in the industry?
The biggest gap is meaningful conversations. So we are very trend-driven in this industry.
True.
And not just from a consumer's point of view, but as doctors, we get invited to so many different launches of everything under the sun. And you go and you're expecting science-driven, data-driven background to what is being promoted. But what you're getting is a 5-star meal in a Michelin star restaurant, which is lovely for us.
Yeah.
But actually, at the end of the night, I still don't feel like we have agreed on what this treatment is.
Yeah.
So there is definitely a gap between the aesthetics of aesthetics and the substance of aesthetics. And that is why, coming from a surgical background like myself, a lot of my colleagues had the same question for me. Why are you practicing something that is not medicine? And you think the way in which it's being practiced is not representative of how medicine should be practiced. But there are those of us here who read papers, who speak to colleagues, who go to conferences, who do research, who run clinical trials. Because this is medicine. It's just not being practiced that way by most people.
Of course.
So the gap is knowledge from the doctor's perspective, but also there's a gap between understanding what is right and wrong from a consumer perspective as well.
Interesting.
So there is a huge void actually in the middle of all of this.
Yeah. And I think the first treatment that everyone names it's the number one that comes in everyone's mind when it comes to, treatment in general or start with something is filler.
Yeah.
There are so many, there are people that hype about fillers and there are people that they say that it's absolutely a no-go. What's your opinion about fillers, especially on the face?
I feel in this industry, everybody has an agenda. So to present facts and allow people to choose for themselves with full consent, informed consent, is the way forward.
Yeah.
Fillers are not for everyone. They are not the answers to everything, but they are not also, something that you should avoid. I am both a consumer and an injector of filler.
Yeah.
I think the correct issue that you're trying to treat, like volume loss, for instance, placed correctly, correct product, correct depth, correct technique of injection, and keeping balance and harmony of the face, plus anatomical knowledge is required to make filler a very successful treatment.
Yeah.
And I have many of my clients on it.
Yeah.
But if you don't understand your technique, you don't understand the product you're using, you don't understand facial anatomy, and you don't understand what the client's actually asking for and what they need. Often what they want and what they need are two different things. It is for you to decide as the expert what they need. And if you think filler is not it, that's fine.
Yeah.
But if you think filler is it, do not be afraid of using it. There are so many myths around it. Like if you have filler, you can't have a facelift. Who said that?
Yeah.
Where does that come from? Often by people who have never operated on the face before.
Yeah.
Or if you inject filler, you get puffy and unnatural, or it migrates everywhere in the face. None of that is actually true.
I think the biggest myth that I've heard is that the moment you start doing fillers, your face kind of like open and then shrink again, and you lose elasticity because it's, it's like a muscle that it grows down and up. Is it true?
It's not true. Otherwise, there wouldn't be any filler in my face.
Yeah.
But I feel that the depth of injection is important. The thickness of the product is important. Understanding that there are multiple layers to your face.
Yeah.
It's not just skin over bone. There are many things in between, and soft tissue, and the placement of the product matters, the thickness of the product matters, and technique is king. It's all about the doctor who is injecting it, less about the product, less about the hype, less about looking like X, Y, or Z.
Of course.
It's more about who is holding the syringe. That's the question you should be asking for any treatment.
Yeah, absolutely. I agree with you. What is the number one thing that we should all know when it comes to fillers before getting them?
Mm-hmm. That is hyaluronic acid. It is absorbable and it is reversible. Mm-hmm. That's the most important thing to understand about it. It is not a permanent injection of anything.
Yeah.
It's not for skin health. There are some fillers that are injected superficially for that purpose, and they are more skin booster filler mixture. But filler is volume loss replacement. If you have volume loss or you want to enhance a feature or balance a face and give it harmony, filler is great. If you have scarring on your skin, filler is not the way to treat that. If you are worried about lines and wrinkles, filler is not your first choice.
Yeah.
You need to think about skin health and the myomodulation and muscle underneath.
Yeah.
So it's all about understanding that it is reversible. It is not permanent. It does not just migrate all over the face endlessly.
This is another misconception, I feel.
And it doesn't cause any issues with facelifts in the future. Mm-hmm. It's all about trusting an injector that is trustworthy.
Yeah. The second product that everyone is happy about right now is Botox. Mm-hmm. So again, there are a lot of myths, but there are also a lot of pros when it comes to Botox. Yes. Honestly, I think online we hear a lot of pros, and we know celebrities and influencers hyping about Botox, but also we see a lot of cases where Botox was completely botched and probably a lot of disinformation around the product. What do you think about Botox as a expert?
I love Botox. And I've used it in many different settings, not just aesthetics. I've used it for voice restoration as well, in spasmodic dysphonia, in people who are unable to speak. Yeah, absolutely.
You use Botox for voice restoration?
You do, yeah, absolutely.
I want to know the story.
We use Botox for swallowing difficulties. We use Botox for sphincter function. There's a lot in medicine that Botox is being used for. It is a muscle relaxant.
Yeah.
But in the field of aesthetics, it can be used to restore facial harmony, facial balance and symmetry, prevent premature aging. In small doses, 2 to 3 times a year, I think is more than enough. If you're having to get Botox at high doses every 2 months, you are lacking skin health, you are lacking knowledge, and you are lacking a great injector.
Yeah.
So Botox for me is a preventative measure. It's something that you can use to really be icing on the cake. It's not the cake. Yeah. Often when people are concerned about Botox, they're treating it as an entire treatment on its own, as though it's going to prevent all sorts of aging processes. Yeah. And it's not. It's the icing on the cake. It's for the glow and the symmetry and the brow lift and the myomodulation. But it's not the only treatment that you should be having if you're concerned about premature aging.
What is actually the treatment that we should have if we're concerned about premature aging?
I think everyone should be concerned about premature aging. And I say that because I'm not anti-aging, I'm pro-aging well. And I think we live in environments and in life and society that promotes a lot of stress, a lot of habits that are not in our best interest, difficulty controlling the water and the air, especially where we live in this region. So you should be concerned about, not concerned, but you should be mindful of premature aging. Depending on your age, your starting point, your cultural background, your genetics, everybody's going to need something different. It's not one size fits all. So if somebody comes to me and they're 25 and they want to get started on their aesthetic journey, I'm not going to fill their face with injectables. That is not my first thought. I'd like to know what you're eating. What is your nutritional intake? What is your lifestyle? What do you do for work? Do you smoke? Do you drink? Do you take any medications? Do you have any autoimmune conditions? I'd like to know what your face routine is at home. What is your skincare routine? I'd like to understand all of that before I recommend an injectable treatment or a machine-based treatment or a chemical peel or whatever it may be.
Absolutely.
If you don't have the basics, whatever you do in office is never going to be good enough.
Absolutely. So. I completely agree. When it comes to lifestyle and when it comes to maintaining a good, skin health, I would say, we live in a region where we have a lot of issues when it comes to water, when it comes to dryness, ACs, and everything. What are the key elements that us living in the GCC regions we have to consider in order to maintain the skin health that maybe we shouldn't consider if we were either in Europe or in Asia or in other parts of the world?
I think with the very basics, if we're starting right at the core, two things come to mind. One is a good water filter, I have to say, and the other is SPF. I mean, there are clients of mine who come to me who spend thousands with me on injectables, but they would refuse to wear SPF on a daily basis.
Really?
They just can't be bothered. And you think everything we're doing in treatment in-house, I know you feel better because spending money on investing in yourself, self-love and self-care. But really that SPF thing that you are skipping every morning is undoing everything I'm trying to do for you,
Yes.
So a good SPF, and there are plenty of great ones around, you could use at least 2 or 3 times a day. It could go under makeup. There's lots of skincare you can use that has SPF built in as well. And making sure that you have water filter that is actually robust, especially in this region, both for hair and face.
Yeah.
Those are the 2 basic things you could do. And then a very good barrier cream and moisturizer always goes a long way.
Yeah.
If you start with these and get the basics as part of your routine, it's just something you do on autopilot, then everything else you add on is that extra bit of help. If you don't use a water filter, don't use SPF, don't even have a most basic barrier repair moisturizer, anything else I do is not going to be as effective.
Absolutely.
So that's important.
You said that you started with, you're specialized in nose surgeries and nose fillers.
Yes.
What do we need to know when it comes to nose fillers? This is a very controversial topic, I would say.
It is. As someone who's operated on the noses a lot, both for functional and non-functional purposes, so for aesthetic purposes as well as for breathing, help with breathing, noses are very delicate structures and they're often poorly understood even anatomically. And it takes many years to become an expert in nose surgery, nor would I say that I am a rhinologist by any means, I am not. But part of my training from ear, nose and throat surgery did focus on this.
Yeah.
So noses have function above aesthetics. And there are lots of aesthetic procedures that people have, like rhinoplasties, that compromise function in the wrong hands. So the very first and most important thing to know is whatever you do must not compromise function, because when breathing is compromised, so is everything else in your body, particularly sleep. And sleep deprivation is at the core of a lot of our problems, but that's another podcast of longevity to run with. But so function must not be compromised, and it must be fully assessed before anybody does any surgical or non-surgical work on your nose. That's one. But talking about aesthetic treatment of noses, you can narrow the nose, lift the tip, hide the dorsal hump, both with filler and Botox. So I usually use a combination of both. So I can change the shape of your nose, I can change the length of your nose, and I can sort of do profile harmonization with the chin.
Is it true that we might get blind from nose fillers?
It is true, yes, from any filler. But nose filler specifically, any filler.
Tell me more about this.
So, filler is being injected into the face where you have vasculature as well, so lots of vessels. The reason nose is a highly sort of feared area is because there are a lot of vessels in that area.
Yeah.
So it is always possible to inject within a vessel where filler can then migrate into certain parts of the face, and being the artery behind the eye being one of them. And it can cause lack of blood supply to the eye, which can cause blindness. Now, it doesn't happen...
Is it temporary or can it be permanent?
It could be permanent. Yeah, wow. It could be permanent. And so it's important that the injector is well-versed in the anatomy of the nose. Complications can happen to anyone, even if they do everything exactly correctly.
Yeah.
But the issue is not with a complication occurring. The issue is when people don't know what to do when the complication has occurred. So in surgery, we have a rule that if you can't fix something you are doing, you shouldn't be doing it in the first place. So that's why we don't operate independently until we're able to deal with our complications independently. And I bring that same idea and principle to aesthetic medicine. You should not be injecting the nose if you don't know what to do when you start to see mottled
Absolutely.
appearance of the skin, because there are many signs before blindness happens that is telling you it is going to happen.
Yeah.
And
so you can actually prevent it if you
Yes.
catch it on time.
Exactly, yes. And you have somewhere between 20 to 40 minutes to do your job properly and make sure that bigger complications don't occur. Obviously, it depends on exactly where you've injected and how much filler and how fast you've injected it and all of those types of things. Also, it's important to consider that a lot of people who come to us for nose filler have had previous surgery on the nose. The anatomy is not where you think it is. So if anyone has ever witnessed, a rhinoplasty, they would know that we actually go at the nose with a chisel and hammer. So things are not where you think they are. And if you are uncomfortable with the natural anatomy of the nose, you're definitely going to be uncomfortable with a modified anatomy. Yeah. So do not inject somebody who's been operated on if you are uncomfortable, because chances are that you would cause
some
an issue
troubles.
and then you're unable to fix it. So I don't want people to be afraid of nose filler. I want them to be afraid of the injector.
Yeah.
It's not the nose filler.
Yeah.
It's the person injecting it.
Yeah.
So it's important to vet your doctor as much as you vet the sort of treatments that you think you need.
Absolutely. I agree. It's about, being sure, trust the doctor and trust the experience that the doctor has and investigate a little bit, I guess.
Yeah.
So not just maybe go to one because of your friend referral, but just investigate a little bit about the history.
Just ask them.
Yeah.
How many nose fillers have you done? Have you had a complication? How did you deal with that? Yeah. Most doctors who come from a sensible training background have no problems at all with that question, because we would get it asked in surgery. Why shouldn't you ask me in my clinic room? If somebody's coming to you for an operation, they're asking you, how many of these have you done? They have the right to know that they are your second patient, or your 2000th patient.
It's good that you point out the fact that it's right to ask questions, as many as you want, especially if you're doing specific treatments, because a lot of doctors also, they can get defensive, or maybe they just won't reply the way you're expecting. So it's good to point out that it's actually our right to ask doctors whatever it comes.
There are a few things I say at the beginning of all of my consultations, and if any of my clients are watching this, they will attest to it. The first thing is trust is earned. I don't expect you to just walk in and trust me because I said so. Yeah. Trust is earned. Is a feeling that is mutually earned between the doctor and the patient. Yeah. Secondly, you have every right to ask me any question you want to ask me about who I am, what I've done, what my expertise is, because you are giving me not just your money, but you are giving me your face. You are trusting me with your health. Yeah. So if you don't ask me, who will? Yeah. And thirdly, if a doctor gives you an opinion that you disagree with, stand your ground. If you don't agree, say I don't agree. Yeah. And it's okay. If you're not informed, they will inform you of the pros and cons. Take your time, go home and think about it. Absolutely. If you don't know something, say you'd like to read about it. That is not an issue at all. Mm-hmm. What is an issue is if somebody is feeling forced into doing a treatment that they don't fully understand, that it hasn't been explained, and the consent hasn't been taken properly. So you're not actually informed when you sign that piece of paper or the iPad. And I think it's important that you feel like you have all the information you need before you say yes or no to something. Yeah.
What actually can help us client to choose the right doctor? For example, how can we differentiate a doctor that really won't go over the line to just sell a facial, a treatment, or a filler?
I think it's important to understand that the aesthetic industry is a business, as is every other medical industry as well. So unless it's, at the point of ER, like as an emergency case, or everything else that's elective is still a business. Doesn't matter which country you're in. So yes, the doctor will try to sell you a treatment because that's what they're hired to do. Yeah. The issue is not with being sold a treatment, it's being sold an inappropriate treatment. Yeah. So that comes down to the ethics and the morals of the clinic you're walking into, because it says a lot about the type of people that they would hire. Yeah. If you go into a consultation and you only have 15 minutes and you have to decide on the spot if you're going to do something or not, you're not in the right place. That is a red flag.
Interesting.
Do not have the treatment. It doesn't mean the doctor is not qualified to do the treatment. It means you don't feel comfortable enough to ask questions. You don't have enough time to explore options. You should have the chance to speak for longer than 10 minutes before you decide on something, especially if it's your first time in aesthetics, especially if it's a treatment you haven't had done before, especially if you're on the fence and you're not sure.
Absolutely.
So if you are being rushed, if you are being sold to, then that's not the right place for you. When people come to our consultations where I am, I haven't come to you, you've come to me.
Yeah.
And you have a full hour to ask me anything you want to ask.
Yeah.
Nothing we do has to be done on the day. You can go and come back to me anytime you're ready.
Yeah.
You will get an aftercare sort of information treatment plan that is that long coming to you via email or WhatsApp. You have time to read it and come back to me.
Yeah.
More than that, I have done a personality test before you've even walked in. Yeah. So if I know you're a nervous individual, I'm not going to try and give you any options to choose from. I'm just trying to give you information, and then I ask you to go home and think about it. Because there's nothing worse than us becoming salespeople in this industry. And I think that's one of the biggest issues.
I completely agree. And because, as I said, it happened to me and I felt extremely uncomfortable. But thank God, because I was following my intuition and I was just like, no, this is not, you're not even giving me the right explanation on why I should get this treatment. I would not get it.
Yeah.
So I think also intuition might be a part of
always
the equation, especially for us women.
Yeah. I mean, you know, if your gut's telling you this person's not for me,
exactly,
don't do the treatment.
Exactly. Yeah. Dr. Maya, how social media changed the perception we have when it comes to aesthetic and, body dysmorphia?
Yeah.
Why right now it's so controversial? It's such a controversial topic. How social media impact the overall cosmetic urge to do things?
Yeah. I think there are good and bad things in everything, and I would say exactly the same about social media. I'm personally a creator on whatever platform I'm on. I'm not really a consumer, so it doesn't impact me directly, but I can understand why it impacts a lot of people who are predominantly consumers on social media. The other issue that we have is as we get older and we go through life, we become a little bit more comfortable in our own skin and we compare ourselves to ourselves. When you're young and impressionable, you do compare yourself to everybody else around you. And in some ways, social media has made it easier for you to compare yourself to unrealistic expectations of others. I say unrealistic because not everybody has the expertise that they can afford around them. Not everybody has access to filters and other sort of image modifying things that we post and apps. And also, not everybody is in a position to actually consider an aesthetic treatment as something for their confidence. So in some ways, it has made it more accessible. There's a lot of knowledge and misinformation on social media. But in some ways, it has made it a lot easier for young people to compare themselves and feel less than. So again, it comes down to the morals and the medical ethics of the doctor that you see. So oftentimes younger individuals may come to me with a picture of somebody else and say, this is the nose I want, or this is the eye shape that I want, or this is the lips that I want. And you're looking at the ethnic diversity between these two people. And you're saying, you are like literally erasing your identity here, and I'm not going to do that. But I'm also going to get you hopefully to see that. Because I have to take that desire to ethnically erase your features away from you, because that's the issue, is not whether I can get your nose to look like that, is the why. You know? And that's really what it comes down to, the type of doctor that you see. And if they are not that way inclined and it's not how they think, then you end up with what's happening in the aesthetic industry today.
What is actually the biggest, I would say, the common misconceptions that you see when every time we talk about anti-aging, especially from women?
That the more treatments you do, the better. I often have to spend time to undo a lot of the things you've done so I can start again.
Really?
Yeah. I mean, it's not the more the better. Sometimes when clients come to me, they have already lost the why. We don't even know why we're having this consultation anymore. There's no more room in your face for me to do anything, and your skin is thinning at this point because you have tried every latest trend. You've gone to, 5 or 6 different consultations in the last month and have done 5 or 6 different things.
Wow.
You know, it's less is more, as Coco Chanel would say. Take the last bit of jewelry you put on off before you leave the house. It's a bit like that in the aesthetic industry as well. Less is definitely more. And don't use your face as trial and error. It's not treatments you should be investing in, it's the consultation you should be investing in.
Yeah.
It really is about what are you taking away from the consultation?
Yeah.
Forget the treatment at this point.
Yeah.
Do you have better understanding of your skin? Do you have better understanding of your biological age? Do you have better understanding of your facial features? Do you have better understanding of available treatment options?
Yeah.
If the answer to those things is no, then what treatment are you having and what for?
Yeah,
You know?
absolutely. And sometimes we might be carried away with those trends. Every now and then there is a new trend when it comes to facials, when it comes to treatments, when it comes to fillers, needling and everything. So absolutely is a must to just differentiate if this trend applies to you or this is something that literally you don't need.
Yes. And you often don't even know why people are doing the treatment they're doing. Why would you do microneedling? Why would you not do microneedling? That's the question. And oftentimes when you look at celebrities or influencers and they want to promote a specific thing for obvious reasons, they don't tell you the 15 other things they've done before that thing.
Yeah.
And you come to me wanting to have that one single treatment that somehow is going to make you 15 years younger.
Yeah.
You think, if I could do that, I would.
Yeah.
But that's not all they've had.
Absolutely.
You know, skin health is so much more important than lines and wrinkles, sure. But this one cream or one injectable or one collagen stimulator is not going to get you from where you are to the picture you're showing me.
Yeah. I think, as you said, everyone has different needs. And I think that by individuality can apply in every aspect of your health. It means that what is good for me might be not good for you. And even in treatments, it really depends on your by individuality. However, there are some general pillars that we might all follow in order to maintain our, youth.
Yes.
What are those? What are the main pillars or recommendations that you would tell women to do in order to maintain,
all the boring stuff nobody wants to do, including myself. I have to actually remind myself that those are the core things we should be doing. So nutritional health, particularly for women, hormones, making sure that that's, you're seeing somebody for that and they're being measured and you're on top of your hormone health. Exercise, movement.
Yeah.
And the very basics, like we talked about, water filters, SPF, all of the boring stuff that doesn't cost you an arm and a leg either.
Yeah.
But it's very, very variable. And, good sleep definitely matters. Stress levels, your day-to-day habits, the little things you do, like drinking black coffee on an empty stomach first thing in the morning and driving your cortisol through the roof.
Yeah. Also because I think that you can do as many treatments you want, but if you don't have the pillars covered, you're just adding up and probably you won't see that many benefits.
Yes. And it's frustrating because you're thinking that is self-love and self-care and investing your hard-earned cash into yourself and then not as much is happening as you think it should be happening.
Yeah.
And then when you think about the basic pillars, I mean, everybody's looking for that magic bullet, right? The one thing I can do that's just going to change everything about me. And oftentimes in life generally, not just when it comes to aesthetics, but in life generally, the secret juice is in the little things that you repeat on a daily basis and not in some big miraculous thing that's going to happen.
Yeah. Dr. Maya, what is your number one, your favorite treatment?
Gosh, that's a difficult one. I have to say skin boosters. So collagen stimulation. I mean, I'm 42 now and collagen stimulation is king. And I started being a consumer in the aesthetic industry a little later than I would have liked. So I would recommend people in their late 20s, early 30s to begin. But I started maybe when I was 35, 36, and I wish I had started a little sooner.
Yeah.
So collagen stimulation, I think for me is king, especially when you are going over the threshold of 35 over. I think collagen banking, as we call it in the industry, is definitely something to pay attention to.
So you would recommend maybe women that, because I always think sometimes as women, even me with my friends, we always wonder, where do we start from? There are so many treatments. We don't know where to start from.
Start with a consultation.
Yes.
With the correct person. I would say don't rush out there to have the latest treatment. These treatments are on the market. They're not going anywhere unless they were detrimental to your health, in which case FDA will then disapprove them. But they're not going anywhere. What you haven't had done, you can always get done. Once you've done it, most of the time you can't undo it.
Yeah.
So take your time, invest in a proper consultation with an expert. and take your time. I mean, just digest the information, go back home, read up on it.
Yeah.
What you shouldn't do is run it through ChatGPT.
Yeah.
But like ask questions, go for a proper consultation, invest in understanding more than you do on treatment.
Yeah.
Treatments will, they're always evolving. You come back to us actually in 3-4 months, we will have something fantastic that wasn't there 3-4 months ago. So treatments are always evolving, whether they're injectables or machine-based or whatever. Science is moving forward at a huge speed in this industry for sure. But what is not changing is the ethics behind it and the consultations behind it. And that is, it takes a little bit of time to find the correct person and have the correct conversation.
Yeah. Dr. Maya, what is the biggest lie the cosmetic industry sold to women that we should not consider?
That you need aesthetic industry. You don't need it. It's not life-saving. It's not limb-saving.
Interesting.
You decide if you need it or you don't need it. It's not for me to dictate that to you.
So it's in our power.
It is. It should always be.
Yeah.
And even as a doctor who is earning a living from the industry, I would say to you, take your power back.
Yeah.
Stop asking me what you need.
Yeah.
You can come to me with a specific problem that you've recognized and I can give you solutions for it. But I do get patients who come in and they say, what do you think I need? Nothing.
This is what I would ask as well. Because
what do I need?
What do I need? Exactly.
Yeah.
Exactly.
No. And that's what the conversation should go down the route of, why do you think you need something? Tell me that and I can tell you what you need.
That's very interesting. Okay, Dr. Maya, I don't know if you're ready, but I have some fire questions for you.
Okay.
They're not really questions. So what I'm going to say is I'm going to name some popular aesthetic treatments and you have to rate them.
Okay.
Are you ready?
Sure.
Okay. First one, Botox.
10 out of 10.
Immediately.
No hesitation there.
No hesitation.
10 out of 10. Correct injector, correct timing, depending on age and everything else, but 10 out of 10.
At what age would you start?
I started at 35. I wish I started at 30, I would say.
Okay, perfect. Fillers.
10 out of 10.
Same. Okay,
Yes.
we love them.
Yeah, definitely. Correct. Again, appropriate.
Yeah.
Yeah.
BBL. And we're not talking about
The
bottom.
BBL,
Yeah.
BBL. Yeah. I think, again, if needed appropriately, about 6 or 7 out of 10.
Okay.
Yeah.
Okay. Is it something that really tighten your skin, as they're saying? Or
Depends on so many things: skin laxity, your age, postmenopause, premenopause, collagen production, what else you've done. So it could be good in the correct patient. Yeah.
Okay. Stem cells.
Ooh, okay. Stem cells, I would say 10 out of 10 ideally. But it has a long way to go in the industry before it can be ranked as 10 out of 10 and readily available everywhere in that sense.
So what you're saying is that they are available, but we need more studies on them?
We need more studies. We need better modes of delivery. We need to consider, again, who would benefit from it, in what capacity, what frequency.
Yeah. Have you seen results from them?
We do autologous stem cells in our clinic for hair growth, and yes, definitely.
Okay, interesting. Microneedling.
5 out of 10. Yeah.
Tell me why.
And again, please don't buy those rollers and start doing it in every which direction at home. Go for proper microneedling.
I love that
you
you
can
share
actually
that.
damage the skin. So again, it's a mode of delivery. It is collagen stimulation as well. But there are many ways to stimulate collagen. It's not my particularly favorite way of doing it. But again, correct hands, correct application of product on top, and it would be good.
PRP, the vampire look.
I can take it or leave it. It's never been my favorite. I would say 5 out of 10.
Really?
Yeah.
Why so?
We have so many things that's better than PRP at the moment.
Yeah.
I think maybe if you asked me about 6-7 years ago, maybe.
Yeah.
But not now.
Salmon DNA, the one and only right now.
8 out of 10. Yeah. Again, I can think of treatments at the moment, injectables that combine amino acids and hyaluronic acid, that I think does a better job. But salmon DNA also, I think, is still an 8 out of 10. Again, correct clients.
Radio frequency.
In the right hands, 7 or 8 out of 10. In the wrong hands, minus 10 out of 10. So,
really? So it really depends on the execution.
It does, and the machine and the person delivering the treatment.
Interesting.
For sure. Yeah.
Dr. Maya, thank you so much for being with us.
welcome.
I'm so sure that now people have a more understanding of every treatment and, the root causes that they need to, first investigate and then learn a little bit more about their identity and also learn to go back to the root cause of the why they want to get a specific treatments. But I'm very happy that you answer a lot of questions that a lot of women wonder. And now we have a clear understanding of this amazing field.
Thank you. Thank you so much for having me.
If people want to get in touch with you, where they can find you?
They can find me on Instagram as well. I'm sure you'll tag me in this. And I'm also on TikTok and also Oranix Clinic in Dubai as well.
Amazing. Thank you so much for being with us.
Thank you so much for having me.
Guys, if you have any question, please let us know. Dr. Maya will be super happy to reply. And I'll see you on the next one.